Hi, I am Dr. Jo Vandervoort, Chief of the Department of Gastroenterology in the Onze Lieve Vrouw Hospital in Aalst, Belgium. Since the last decade of the previous century, the use of self-expandable metal stents became an additional tool in the treatment of obstructive left-sided colonic carcinoma. There was this opportunity for new treatment approaches since it remained undecided which was the best surgical technique to be used. Over the last 2 decades, self-expandable metal stents has proven to be the first choice of treatment in a palliative setting. This is as such included in the guidelines published in November 2014. At that time, there was, and there still is, a lot of debate about the role of self-expandable metal stents in potential curative or bridge to surgery setting. This doubt was mainly fed by the Dutch Instant 1 paper. This randomized control study was stopped early because of a high mortality rate in the stented arm. A recent published meta-analysis performed by an Italian group shows an advantage of self-expandable metal stents compared to emergency surgery in the short term, which means 60 days past procedure. They find a similar mortality, but less temporary and permanent stoma formation and higher success rates in primary anastomosis in the stented group compared to the emergency surgery group. However, there are only very few data on long-term survival following the use of self-expandable metal stents in a bridge to surgery setting. As a reaction on these results, we prepared our own data for publication, since we didn't have this same experience in our own institution. Our data show that the overall survival of patients treated with self-expandable metal stents for obstructive left-sided colon carcinoma in a potential curative setting is not inferior to the survival of patients with similar stages of non-obstructive left-sided colon carcinoma. We recognize shortcomings to our study design in comparing our group to the group of patients in the Belgian Cancer Registry. However, we are comparing to a group of patients with similar disease and disease stages in the same country during the same time period, making sure they received the same sort of treatment with similar chemotherapy regimens. An important remark to make is that patients in our so-called control group should theoretically have a better outcome, since the majority of them did not have obstructive disease, compared to our group where all patients presented with full colonic obstruction. We hope to refuel the debate on the use of self-expandable metal stents in the bridge to surgery setting with our promising data on long-term survival, since current guidelines only leaves limited space to continue this treatment in high volume and expertise centers. In the meantime, our center participates in a Dutch initiative where a registry is created to validate the current guidelines. I thank you for your interest in our data and wish you good fun in reading our paper. Thank you.